Thanks a lot for joining in, Mr. Surya Narayan, the National Sales
Yeah.
Manager, Strategic Key Accounts, All India Minds India Private Limited. Just now we had the inaugural session where we had a good interactive session by the various association heads of healthcare domain. Now we have an interesting industry presentation where Mr. Surya is going to present us about stepping into an intelligent future of modern healthcare. So the topic itself seems very interesting. So I would like to, give it over to Mr. Surya for the presentation. Thanks.
Thank you. Thank you very much, Pratibha. Am I audible?
Yes, sir, you are audible.
Audible. Is my screen visible, Rajeshwar?
Screen is not yet visible. Yeah, it is now.
Yeah. Okay. Can I start now?
Yeah, please go ahead.
Okay. Very good morning to all the esteemed guests. Thank you very much, eHealth and Elets, for giving us an opportunity. I think it's our privilege to be a part of this brilliant program. I think Mindray India and me representing the 10th Healthcare Leadership Forum, which is again a virtual event, which adversity has given us, created this opportunity for us. Thank you very much for giving us this opportunity to be a part of this program. We have great leaders here. I have I have a long list in the group. We have Hari Prasad sir, we have Dr. Harish Pillai, we have Dr. Rupak Barua, we have Mr. Hari from Medicare. I think they're all the trendsetters in this industry. I think we have all grown along with them. We have the entire healthcare infrastructure and the healthcare delivery, what has been today in India, is all because of them. With their wishes and with their vision of taking Bharat to the next level, we are putting our small piece into it in terms of making it more better. Can we have the video to just kickstart before I get into my presentation?
India, a land of many faces. It's the bustling markets of Delhi, the thriving streets of Mumbai, and high-tech powerhouses of Bengaluru. It's feeling the beat of different pulses and the harmony of different sounds. It's where trust is placed in a critical moment with our life support. It's where reliable data are transformed into discovery with our IVD solutions. It's where intelligent inventions save lives with our imaging technology. And where healthcare is advancing with more possibilities. It's the trust in your partner that makes history, whether big or small. As your trusted partner, together we will reach the summit and watch the sky glow. Together we will build a healthier Bharat. Mindray, healthcare within reach.
Thank you, Rajeshwar. Yes, we are the trusted partner for Healthier Bharat, building intelligent future for modern healthcare. Let me get into my presentation. So our mission is better healthcare for all, and our vision is advanced medical technologies to make healthcare more accessible. Just to give you a quick glimpse of what is it Mindray is all about, that we believe in R&D and we have consistent investment which is going back to our R&D in terms of making us better and better in terms of technology, delivering innovative solutions which are going to make sense for the patient. So we have more than 8 R&D centers across the globe. We have about 2,500 plus R&D professionals working in those infrastructures. 10% of our annual revenue actually goes back to the R&D. And we have more than 5,000 patents. We have 15 patents recognized in the US, and just keep going with our commitment. So collaborative innovation, cutting edge technology is the way to go if we need to build an intelligent future for modern healthcare, and we are committed to it. Look at the innovations what we have done in the past. So started from our 1991, continuously we have been delivering products year on year, quarter on quarter, which is at par with cutting edge technology and actually making sense for the patient in terms of delivering better healthcare for the healthcare deliveries. So what is it? Without compromising on the quality, ensuring that we adhere to 100% compliance, we deliver with better quality and with exceedingly well capacity. Look at the departments, holistic solution. We are not operating in silos. You talk about an emergency care, which is the entry point of any of the hospital. You talk about a radiology department, you talk about a laboratory, an operation theater, induction room, recovery, including the air ambulance, which is very critical today, where we are talking about saving lives. We are present in every single segment of the hospital. So just to give you a quick glimpse, we are the global leaders. We operate in 3 important verticals. The first vertical is more to do with critical care. We are talking about patient monitoring and the entire life support. This includes starting from an automatic external defibrillator. It talks about the entire range of patient monitor addressing to various acuity levels. It talks about the entire ventilators from neonatal to the adult with all the advanced features and modes which are inbuilt into the system. We talk about the anesthesia machine. We talk about the OT lights. We talk about the OT tables. We talk about the syringe pump, the infusion pump. The latest introduction is that we are also coming and hitting the market with one of the best products in laparoscopy. So this is the commitment what we are trying to show it back to the country in terms of delivering the best technology and the cutting edge technology available for the customers. The next is very important is our in vitro diagnostics. We are the leaders in India, especially in the 3-part, 5-part, and the 6-part. We are exceedingly doing well, and we have very strong presence in hormones, and we are also getting into biochemistry. Medical imaging systems. Look at the domain what we have. We have systems from black and white to the best, which has almost all the configurations. If we talk about the shear wave elastography, you're talking about heart modeling, everything is available. And the departments, we talk about general imaging, we talk about cardiology, we talk about point of care, we talk about mobile radiology, and so forth and so forth. Patient monitoring, very important is the emergency care when we transport. This has been a big hurdle, and the doctors used to really think that how do I make the information flow seamlessly from an emergency to the rehabilitation, to the HDU, into the pre-operative, getting into the operation theater, and then getting back to the ICU. I think Mindray has solutions end to end. We talk about informations which are seamless within the hospital from the emergency till the patient get discharged. So I'm sure that we have great leaders here. What is their biggest challenge today is that evidence-based medicine, which is very, very important, and Mindray feels that whatever technology we have and which we build and which we innovate, and the amount of vision what we have, all need to be built on an evidence-based medicine. So what can we offer to you is that you actually have the information even before the patient gets into a critical situation. It's about intervention or it's about prevention than getting into intervention. So what we have done is we have some early warning scoring technology which are inbuilt into the monitor. So these are checklists, these are protocols which are very effective, which are built into the monitor, which starts correlating with the patient hemodynamics and start giving you alarms very smartly, where a sister or a paramedical staff can pick up information and inform to the doctor for immediate intervention. Look at the information which are available. It clearly picks up looking at the dynamics, looking at the hemodynamic information which are available, looking at the alarms which are being smartly populated. It backscores and then tallies with the algorithms which are inbuilt in the monitor and smartly gets the information to the doctor for prevention than getting into an intervention. What is very important today is that all these informations are available and they are talking in silo. How do I make the life of a doctor very easy, whether he is at hospital or he is at vacation or he is at home? What I'm trying to do is that all the informations are at his fingertips today. The critical informations, the alarms, the entire trends, the entire event is all at his fingertip, where the information backflows back to his mobile or to his laptop or to his iPad, where he will be in a position to access even before he gets into the hospital. This can also have a direct interaction even before the doctor gets into the hospital. He will be in a position to have the information at his fingertips. So why is it so important is that we want to re-emphasize it is an evidence-based medicine. It's not again through a WhatsApp or some kind of unregulated information flow. It is all documented and it is all on the evidence base where the doctor will be in a position to get into the therapy for that particular patient. So we talk so much about saving lives. We talk so much about every minute counts. So Mindray has a solution. From the patient at his residence, I believe in a position to have the information flowing back to the hospital through our defibrillator, which is very smart, which has all the capabilities built into the system. It has all the hemodynamic information and it also has the transmission facility. As soon as the ambulance picks up the patient from the residence, all this information are back transferred to the emergency base station at the nearest hospital, and the doctor at the emergency care will be in a position to actually identify what is the problem of that particular patient. Is it going to be a cardiac arrest or is it going to be a stroke? And some of the therapy can even be started in the ambulance before even he gets into the hospital. And the best part is you are making the hospital completely ready even before the patient gets into your hospital. This is where we will be in a position to add value to the clinicians and to the healthcare providers, where we will be in a position to have more information in terms of helping more lives. Sepsis protocol. This has been one of the biggest challenge in an intensive care. The intensivist used to really have this information in a book, but what we have done that this entire guidelines is incorporated into the monitor. So what the doctor or clinician has to smartly do is just switch on this particular function in the monitor, and the monitor will do the most of the informations for the doctor in terms of even putting the score. Isn't it phenomenal in terms of saving more lives? So we believe that prevention is more than intervention. So once you go and switch on the protocol into the main monitor, it starts getting this information very smartly interpreted so the doctor can get into the intervention. Again, I was talking about the diagnosis. We have certain exceedingly technology which are inbuilt into the system, which will actually pick up information and show it to the clinician in a much better way. So again, I spoke about anytime, anywhere. The entire system within the ICU, whether it is going to be an infusion pump, a syringe pump, a monitor, a defibrillator, ventilator, all this information can be hooked on to a central networking system where a doctor can have all the informations which are, even while they are working in isolation or while even they are working in their own capacity, I will be in a position to integrate all the information for that particular patient, which gives a comprehensive report to the doctor. This is again a very smart, we are talking about spot check, where we wanted to have these informations available in the OPD. I think we have smart devices where we have a lot of clinical studies and white papers presented in terms of having this at the OPD. Ventilation, name the modes available in the industry today. All the advanced modes which will help in terms of weaning the patient better is all inbuilt into the system. We're talking about infection, disinfection solution, especially in the COVID situation. It is very important. I want to show you some very interesting. So we have started putting a lot of artificial intelligence into our systems. I want to just give you a small video. The audio control engine is successful and is welcome to use. B mode. Power mode. The audio control engine is closed. Thanks for your use. Isn't it interesting? I don't want the doctor has to just hold the probe. The rest of the information is all voice prompt. And this makes the life of a doctor very easy, especially when you have to really play around in terms of penetration or in terms of switching modes. It doesn't need to really fiddle around with the system. Just on his voice prompt, things will automatically listen and then get changed. Again, we are building a lot of artificial intelligence on the lab, on the in vitro diagnostic segment of it. Again, we are talking about cutting edge technology in imaging. We are talking about V-flow. We are talking about elastography. We are talking about contrast imaging, which are the trend where the clinicians are actually looking at it. Again, we are talking about reliable results, very efficient workflow in IVD, and we are also talking about getting you a very robust operation. So I also wanted to give you a bit of glimpse. How did our team perform in this pandemic situation, which was very critical, and it was a very big need because you never stopped in terms of taking patients. So if you did that, what does Mindray can come and extend is this is what we could extend. Our professional service team is at your doorstep, at your call. We have 24/7 hotline available in the country. Look at our engineers. Whether it is COVID or a non-COVID, we are with you. We were with you in terms of difficult times. Very clearly, a holistic approach, whether it is going to be a business goal or it's going to be product and solution, it's going to be social responsibility. I'll talk about social responsibility in the coming slides. Talk about the customer care and also the employee development. Everything was seamless even in these difficult times. Look at our backend, the logistics. We were committed. Your hospital was open. Your emergency was open. Your ICU had patients. You were struggling. The healthcare warriors were absolutely 24/7 available in the ICU in terms of saving patients. So what were we doing? We were absolutely putting our infrastructure in place and ensure that we delivered our equipments on time in terms of meeting your needs. Sharing knowledge. We never kept quiet. We started engaging with customers. We started getting some of the good practices and started getting information across the globe and across the country. Our clinical application experts, technical experts continue to keep doing the training programs with the doctors. You can see even in the PPE kit, the customers, the ventilators are being demonstrated, the lab are being serviced in terms of making sure that we keep up your expectations. With great leaders, we continue to still have some of the online events which we were taking it forward. So when we are talking about corporate responsibilities, we are very it is very important for us to be part of this particular CSR activity. And the commitment what we are trying to bring it on the table is we are with you in terms of bringing that technology which is going to make sense, which is going to help you in terms of taking more patients, more challenging patients, and make healthcare within reach. I once again thank the entire team to give us this opportunity and be a part of this program and give me time in terms of sharing this short information to the entire panel of leaders. Thank you very much.